Dr. Payne, tell us about urinary incontinence, when it begins.
Urinary incontinence, the two most common types we see in an OB/GYN office are stress urinary incontinence. That's when a woman coughs or sneezes and they have involuntary loss of urine, and urge incontinence, where they hear running water, the car keys, and they can't make it to the restroom in time. There's other types of urinary incontinence, but those are the two most common we see. And we link those to the pelvic floor. A woman's pelvic floor is like a trampoline, and sometimes the bladder can become displaced through a lifetime of heavy lifting, coughing, constipation. Childbirth is probably the number one thing that affects that. And so that's the two most common types of incontinence we see, and they're easily and readily correctable now.
Tell us about the treatment.
We initially start off with people talking about something called Kegel exercises, where they flex their pelvic floor muscles to strengthen that. And the way I encourage people to figure out what those muscles are is to stop their stream in mid-urine and stop it and start it. And those are the muscles you need to squeeze hang when they're walking around.
To practice.
Right, to practice and to flex those muscles and build the muscle mass. The secondary things we can do, if it's a displacement of the bladder with stress incontinence, it's a simple procedure called a mid-urethral sling that can help tack the bladder up and create an area for when the cough or sneeze, the pressure happens, that it kinks the bladder neck. And then beyond that, the urge incontinence, there's multiple medications now that can take away that urge, and some bladder retraining.
So there are options for women.
Yes, there are. I think that's the biggest point, is for the women to bring it to our attention, because I hate to see women suffer at a cocktail party or anywhere coughing and sneezing and getting the P posture. I think that we can do a lot to help them.
All right, another issue facing a lot of women is uterine fibroids. Tell us about what they are, why they develop, and what treatment there is available.
Uterine fibroids are a benign, smooth muscle tumor that grow on the uterine wall. And by benign, I mean they don't become cancerous. There's multiple treatments for that. There are now medications that can shrink those, anti-hormonal medications that can shrink the fibroids. There's uterine fibroid embolization that's done by our colleagues in radiology. There's also myomectomies where we remove the part of the fibroid, and also there's hysterectomy. There's multiple options, and it just depends on the size and the discomfort that the patient's having.
How would a woman make that decision about what option is best for her?
Depends on where she is in her childbearing as well. If she's young, she may want to preserve her fertility. If she's 50 and finds these things when she's menopausal, she may decide she doesn't want her uterus anymore at all. So it depends. That's a decision they need to discuss with their doctor, and just know there's lots of options, and it includes other specialties other than just OB/GYN.
And when seeking out a physician, what should they look for in making sure they're getting the best care?
I think all women and just everybody in general should look for board certified physicians, so they've passed a rigorous test of exams and maintain their current standards. And I think that's the first step. And then beyond that, if you go to your primary care doctor or your gynecologist, they can plug you into the right people or right specialists you would see after that.
Great information. Thank you.
Thanks for being here.